April broker webinar. We started here. My name is Frances Fiat, and I'm the sales manager for HealthSource RI for Employers. And today our webinar is going to be on the evolution of HMOs, health maintenance organizations. We are to have Emily Colton from Neighborhood Health Plan of Rhode Island as our guest presenter today. Emily is a sales and marketing consultant for commercial products. She has this role since 2014. Neighborhood Health Plan of Rhode Island launched their commercial product portfolio. Emily manages the sales operations for the small business products, and she is also responsible for neighborhood broker relations and her passion to bring brand awareness to the Rhode Island business community. A couple of housekeeping items for everyone. It is best if you can keep your phones on mute so you don't have any background noise. We do chat line open where you can write in questions that will be addressed at the end of the presentation. So we now get started on HMOs Then and Now. The thing I would just like to review with everyone high level is about HealthSource RI for Employers. It is the exclusive source for offering employers a multi-carrier option, basically a large group benefit for the small group market. We have a choice model. There's no eligibility requirement around number of employees who enroll, but it does give employees the option to pick and choose different plans across multiple carriers. There is a defined contribution model for business owners to help them control their costs and their annual health care budget. Okay, I turn this over to Emily.
Okay, thank you so much, Anne. Before I dive into the content here on the presentation, I do just want to remind everyone that we are very happy to be able to provide a giveaway. There's a $100 Newport Restaurant Group gift card. So there's multiple restaurants in Rhode Island that this gift card is, can use it at. So this gift card is going to be for brokers that were able to join in on this webinar. So after the call, we will make sure that we put all of your names into a hat, and the lucky winner, we will send you an email to let you know about that gift card. Okay, I am very happy to be here and to be able to present on this topic. I think that in order to truly appreciate where HMOs and health maintenance organizations are currently, I think it's really good to start with understanding where they started from. So health organizations, or HMOs, were first designed as a way for employers to offer health insurance to their employees. They were called prepaid plans. These focused on hospitalization and care for chronic illnesses and injuries. Men had to go to doctors, facilities, and hospitals that were participating in the plan, and the networks were very small compared to what they are today. Then the Health Maintenance Organization Act was passed in 1973, and this provided a trial federal program to promote and encourage the development of HMOs. So providers would contract with employers to offer the coverage to their employees. Local networks that allowed employees to see providers were created, and networks were close to where the employees lived and worked. And then the prepaid plans changed to more of a concept and an idea of managed care plans. And that's more so where HMOs are today. So this kind of all changed again in the late 1970s when insurance companies started to partner with provider HMOs, and then started to broaden their networks. So in the 1990s, legislation was passed that required plans to cover things like hospital stays for things like baby deliveries, and also wanted members to have better access to specialists. So other than very, very small networks with limited, coverage options, they still need to have to expand these in order for them to be, high quality type of plan design. Fast forward to more, today in recent years. 2010, the Affordable Care Act was passed, as probably everyone on this call knows, and we're going to dive more into that over the next couple of slides. But also something that's really important to remember is that because of the Affordable Care Act, in 2013, we had the launch of HealthSource Rhode Island for Employers. And I think it's really important for everyone to understand how lucky we are in Rhode Island to have our own exchange. So if we didn't have HealthSource Rhode Island for employers, we would be having to go through the federal marketplace. And that we have so much more control having this here in Rhode Island. From 2013 to current day, a lot has changed at HealthSource Rhode Island for employers for the better. What did the Affordable Care Act do for HMO plans? One thing that it did is it required the essential health benefits to be covered. So essential health benefits ensure that everyone in the individual and small group health insurance market have access to comprehensive coverage that actually covers the services that they need. Prior to the Affordable Care Act, whether you were in an HMO or a PPO, in one plan, you didn't know if you switched to another plan if certain services were going to be covered or not. A lot of times, members and consumers are kind of playing a guessing game. So the Affordable Care Act changed that. And some key examples of what essential health benefits are things like emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, behavioral health treatment, and then also preventative services. So the Affordable Care Act covered preventative services at no cost to the consumer. This is very important for an HMO because most HMO models require you to have a PCP. So PCP, your primary care physician, is going to see you for your annual physicals, and it's going to be no cost to the consumer. I'm sure that everyone on this call, when you are speaking with your clients or potential small groups, employers and employees, people still don't know that preventative services are covered at no cost. So it's very important that we all remember to yell rooftops because it's such a great benefit. The other thing that the Affordable Care Act did is it required insurance companies to cover all pre-existing conditions. So the else that I get all the time where potential members will say, well, switch over to you, is my chronic disease, illness, or condition going to be covered? And it's really great to say, yes, no matter what plan you have, yes, all your pre-existing conditions are covered. So also women and men are going to pay the same age-based premiums. Men are no longer going to pay more than men for premiums. And coverage up to age 26 on your parents' health insurance plan is something that is also now available because of the Affordable Care Act. Last but not least, HMOs are a cost-effective option for employers to offer high-quality plans to their employees. So basically, for the most part, you have two kinds of main plan design options to offer your clients. You have an HMO or you have a PPO. Consumers are traditionally going to pay less in premiums for an HMO plan when compared to a similar PPO plan. So why is that? Some reasons could be that they're mostly a smaller network than PPO. In-network coverage is covered in an HMO. In a PPO, in-network and out-of-network coverage is covered. So those are the two kind of main differences between the two plan designs, and we'll continue to dive into that later on in the presentation. As well, you can see that from the early days to current day, 2018, the HMO model has become so much stronger. A lot has changed for the better, and what we're going to talk about over the next few slides is how the role of a broker is going to help to educate your clients and consumers on how the HMO model is something that people should be looking at and considering. So as a broker, it is very important to understand everything that has changed over the last few years in particular, especially because of the Affordable Care Act. And these are three kind of top questions that I think is important to ask your clients. So first one is, all of your employees live within the service area of this HMO plan, so whatever HMO plan that you are presenting. Second question, do your employees see doctors within that same service area? The question is, how often have your employees and their family members, how often have they actually seen an out-of-network provider in their current PPO plan? area or even outside of the service area, but theirs are in the service area. And over the last few years, they have only utilized doctors, providers, facilities, hospitals within their in-network service area. Then it's really important for your clients to stop and think about that. This is an HMO model that's going to be less expensive in premium and actually cover exactly what they're looking for in the providers that they're seeing. They should be looking at this. So for your role as a broker, if you're asking these questions, you then know how to take the conversation from there after these types of questions, have been answered. One of the reasons why we were invited to kind of partner and co-present on this topic is because the HMO plans that are offered through HealthSource Rhode Island for employers are offered by Neighborhood Health Plans of Rhode Island. So the 5 plans that Neighborhood offers through HealthSource Rhode Island for employers are all HMO models. There are some differences, though, between our plan designs and a traditional current day, HMO model. And we want to make sure that everyone on this call and all brokers here in Rhode Island and Massachusetts are, presenting our plans, understand what those differences are. So first, members are required to have a PCP, but that PCP is not a traditional gatekeeper. NABE does not require our members to get a referral in order to see a specialist. So as long as the provider or facility is in work, members can call to make an appointment. So as long as you have a PCP, you can go on to Neighborhood's Find a Doctor portal, search any type of specialist or facility that you're looking for. You can call member services, and they can help you find a specialist that has an open panel and is currently accepting new patients. You get a referral from your PCP. Sometimes that can be faster for a member, to get in to see a specialist, but NERD does not require that in order to, pay the claim. The PCP assignment is important for no-cost preventative care and managing the health needs of their patients who are ours. So that is very traditional in an HMO model, having to have a PCP, and we really understand and kind of stand by the importance of members having a PCP to manage their care. A really important thing to make sure that your clients are aware of is, per ACA, our members and all members of health insurance plans are covered nationally for emergent and urgent care issues. So if one of our members is traveling outside of our network, they're driving up in Maine, they're down, in Florida on vacation, they're across the country, and they fall into any type of urgent care or emergent care situation, they are going to go to the closest urgent care or emergency room, and it's like they're here in Rhode Island in terms of their cost sharing. It's very, very important to make sure that they know that. The same thing goes for traveling outside of the country. So all emergent care is covered if members are traveling outside of the country. As if our members are being referred outside of our network by their PCP or specialist, NABE is going to research each out-network request case by case to examine our network and see if there is a specialist or provider in our network that can care for that member. So rather than every single member paying for a larger network that data has shown is traditionally not used as much, our members we can look at it case by case and see what our members need. So to all up, if your clients' providers are in Rhode Island or even in the bordering towns in Massachusetts, it really is worth your while to present Neighborhood, to present the HMO plans that are offered through HealthSource Rhode Island for employers to them, because the employers will save money, the employees will save money, and they still have access to a very high-quality health insurance plan. So at this point, I want to open it up to any questions. This could be anything in terms of questions about HMOs in particular. It could be anything, even right now, I would say, on the full choice model with HMO plans through HealthSource Rhode Island for employers. And if you don't have anything now on the call, too, you can absolutely feel free to email me or your folks here at HealthSource Employers.
All right. So we have items on the chat line. So this is Fran, back end. I just want to thank everyone for logging in for the webinar today. I want to know that our next webinar in May will be Thursday, May 17th at noon. And the topic is going to be the latest information on healthcare reform. Our guest speaker is going to be Christopher Condalucci. Chris is the principal and sole shareholder of Christopher Condalucci Law and Policy Making in Washington, D.C. Chris participated in the development of portions of the Affordable Care Act, includes the exchanges and market reforms, as well as taxes that were enacted under the law. A unique level of expertise relating to tax law, ERISA, as well as the Affordable Care Act. We look forward to having him be able to share his input on the latest news of healthcare reform next in May. You will be receiving your broker invite through now from Jocelyn. Also want to hear your feedback. If you have any other topic suggestions, please let us know. Follow up today's webinar. Need more information for brokers who want to get certified with HealthSource for Employers? Please contact Jocelyn. Her number is on the screen, 1-57499-2068. And her email is Jocelyn, her line is HARDGITTINE at nsphealth.com. Feel free if you want to reach out to me. I know that brokers are connected to the sales representatives that work here who work for me. Again, I'm the sales manager. My direct line is 401-236-8009. My name, Frances, F-R-C-E-S. My last name, T-H-U-O-T-T-E, at nsphealth.com. Thank you for joining us.